The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanek, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Hello, everybody. Welcome to the next episode of TMD Demystified. I'm Tony Urbanek. Today, we're going to talk about a simple topic. In my mind, it's very simple. Quite surprising that in the mind of patients and including doctors, it's not very simple. But this is what I've experienced and established over treating TMD for 50 years. The title of today's episode is Do Not Conflate TMD Symptoms and Cause. Do not conflate TMD symptoms and cause. I think probably first thing I need to do is we need to define conflate for everybody. If you're not familiar with the definition of that, as Voltaire, I quote him frequently, as Voltaire has said, if you are to argue with me, you must first define your terms. So let's just define conflate, because it is critical to what we're going to talk about in the next few minutes. Conflate means to mistakenly combine or blend two or more separate ideas, concepts, or situations into one, treating them as if they are the same thing, which often leads to confusion, misunderstandings, or lack of clarity. It's like confusing distinct topics into a single, often muddled concept, obscuring important differences and relationships between them. In my mind, that is an amazingly accurate definition, which actually I asked for Wikipedia to give me a definition of that, and that's what I came up with. To mistakenly combine or blend two or more separate ideas. So the ideas that are absolutely constantly confused among both doctors, dentists, and patients are the two concepts of symptoms and cause when it comes to TMD. The doctors out there well known, if you have diabetes, type 1 or type 2, you know, what the causes are of that. If you have a brain tumor, you get an MRI, and it's very obvious what the cause of those symptoms are. If you have a brain tumor, so you know what the symptoms are. You may not know what the cause of that brain tumor is, but you know what the symptoms are. When it comes to TMD, which I heard recently, and I like the concept. It's been called the Wild West of dentistry for 50 years. And I certainly believe that has been the case. And I have been at it for 50 years, a little more than 50 years, treating TMD both surgically for the first 36 years of my career and 2,000 temporomandibular joint cases, as most of you who follow me know. And if you're a newbie to TMD Demystified, over the first 36 years of my career, I did 2,000 temporomandibular joint cases, half of them open joint surgery through an incision in front of the ear and half of them through an arthroscope. And after 2,000 cases, I decided that long-term solution for TMD was not going to be a surgical solution, because a third of my patients, no matter what kind of surgery I did, and I did them all, I did a few types of surgery much more common than others because they were the most successful. But after 2,000 cases, I decided the results were not good enough, because a third of my patients, no matter what kind of surgery that I did, would be back within a year or two with the same symptoms. So surgery was not the answer. So 15 years ago, because of my broad background and experience and degrees in both dentistry and medicine, and academic degrees in cell biology and anatomy, and a couple years working for the NIH on my own independent research project on facial growth and development, I decided I had enough knowledge, potential knowledge, to figure it out, which I did. Which is not what we're going to be talking about today, really. What we're talking about is the problem of conflating symptoms and cause when it comes to patients and doctors who think about the problem, who are confronted with the problem, who either have the problem, have the symptoms, or confronted with a patient with the symptoms and ask for the doctor's help. Again, because my familiarity, I have to admit a little frustration, because it's so obvious to me, but to this very day, to this very moment, because I continue to treat patients 1 day a week. My day to treat patients is on Monday in our practice, and the rest of the time I spend developing TMJ services, which enlists other doctors throughout the United States who use a proper protocol and device that actually solves the problem. So most of my time I'm running a company, but I still practice and see patients on a routine basis. Monday is my day, and it's usually extremely busy, with anywhere between 5 and 8 consults a day and all the follow-ups that come with that. So I get to see, to this very day, a continual line, first of all, of patients who I don't expect them to be doctors, so I don't expect them to actually be familiar with differentiating the cause when the actual cause has been described for 50 years as something else, because it's been the Wild West. And we have the TMD gurus out there who throw stuff at the wall to see if it'll fit or stick, which has been the common denominator for TMD treatment for 50 years. But the point is, patients conflate the symptoms, and I can have that. The doctors who conflate symptoms and cause, I am mystified how that occurs. So let's just really describe this in detail a little bit, see if I make sense. Because when I talk to patients and doctors about this problem, my initial statement is, what I'm about to say, if it doesn't make sense, time out. Just tell me it doesn't make sense, and we'll either fix that or move on. But I never have a need to move on, because in the end of what I have to say, patients and doctors say, that makes sense. Or the doctors say routinely, you just taught me more about TMD than I learned in dental school by far in 10 minutes. I hear that from the dentists all the time. All right, patients and conflating. Conflating between symptoms. The big one is they think that clenching and grinding is a symptom. Clenching and grinding, bruxism, actually damages the temporomandibular joint. There are 3 ways you can damage a temporomandibular joint, 3 categories that damage the temporomandibular joint. And they are bruxism, clenching and grinding, acute trauma to the head, the face, and the jaws of various kinds, and functional malocclusions. Functional malocclusion being defined as your teeth don't meet together correctly to the point that you overload the joint. If you overload a joint, it will become damaged. If you, like me, spent years and years jogging, running, I've damaged one of my knees terribly and have to deal with that. But the damage was done by overuse of the knee. And you can damage a joint, any joint, with a traumatic incident. And in this case, with the jaws, with the lower jaw against the upper jaw. If you have motor vehicle accidents, and whiplash is one of the most common accidents that cause damage to the temporomandibular joint. And then the most common thing that damages the temporomandibular joint is bruxism. It is much more common than trauma and much more common than functional malocclusion, but not 99 to 1%. I would guess, and this is a guess, bruxism is involved in probably 2/3, with another 10% acute trauma and roughly 20% functional malocclusion. And after 8 or 10,000 consultations and listening to the patients with these symptoms, that's my opinion. I think it's about 70% bruxism, 10% acute trauma, and 20% functional malocclusion causing the damage to the joint. But you cannot get TMD, temporomandibular joint disorder. It's a single disorder. It's not multiple disorders. Multiple symptoms for sure, but one disorder which creates multiple symptoms, the symptoms being frequent and or recurring headache, earache, jaw pain, neck pain, ringing in the ears, subjective hearing loss, a feeling of fullness in the ears, dizziness, vertigo, upper back and shoulder pain and tightness, arm, hand, finger, tingling and numbness, and various kinds of jaw locking. Those are the symptoms that actually are created by chronic inflammation within the joint. So the sequence of events, the domino effect, is first you have to damage the joint due to one of three causes. Then, once the damage is done, if the damage doesn't heal properly, it creates chronic inflammation. If it heals properly, what happens is the joint is damaged, the joint becomes inflamed, and inflammation goes on to its natural, normal endpoint, which is healing. And that can happen to a joint. You can damage a joint, it can become damaged, it can become inflamed, but the inflammation, which is the body's response to damage in an attempt to heal, does its job correctly. But if it doesn't, if you continue to overload a joint, or if you continue to have functional malocclusions, which continue to damage a joint, or the acute trauma is so bad that it is never going to heal because the trauma was so severe, your normal inflammation will develop into chronic inflammation, which is a different cell type, different cell exudates, which then goes on to create further damage to the joint. So the first damage is only the first damage, which then goes on to additional damage as chronic inflammation continues over days, weeks, months, and years and decades. The average patient we see in our practice has been run around in circles by the dental and medical community regarding their disparate symptoms, which I just mentioned, for decades. The average person comes in here with anywhere between 5 and 30 years of this problem going on before they finally filter in and referred into us with somebody suspecting this may just be temporomandibular joint problem. So patients themselves conflate bruxism. They think that's That's a symptom. No, bruxism actually causes damage to the joint. And then the dominoes fall, and as I explained, and then chronic inflammation creates the symptoms, which we are not going to go in today. I've discussed that on multiple episodes. Please refer to prior episodes on how chronic inflammation, scientifically, academically, cell biology wise, and neurologically wise, creates each and every one of those symptoms that I mentioned. It's quite striking and quite simple. And patients, when you interview patients, be patient with the patient, because the patients will describe their symptoms differently. They will say that pain around the head and neck, especially in the midface, and most common would be pain here, and they call it sinus pain. I'm having sinus pain. Well, you can have sinus pain. You can have sinus infection, which can cause pain. But asking an additional question or two, do you have drainage? Taking a simple x-ray, taking a panorex, are the sinuses full or the sinuses clear? You can tell right away that what the patient interprets the symptom of sinus pain is actually facial pain associated with muscle tightness, pulling on the bone, creating the symptoms. So that's as far as the patients go. Now, the patients I give latitude to, but the doctors, they should easily distinguish between symptoms and cause. But they routinely, and the reason I know this, they routinely treat the symptoms as if it was the cause, without any idea of why this pain occurs. The most common recently that we see constantly, patients come in either being treated already by a doctor with botulinum toxin A, Botox is the most common drug. It is a drug, and it paralyzes muscle. And it is most common now because the Botox companies, botulinum A companies, have a tremendous amount of advertising money to convince dentists and other healthcare providers that if you have a pain in and around the head, you just paralyze the muscle and the pain will go away. Well, they are correct. If you have a pain right here, let's just say the temporalis muscle, and it hurts right there, you can paralyze that entire muscle, and the muscle will not contract at the direction of the nerves, which when the joint becomes inflamed, the nerves say, tighten up, don't move the jaw. And the big muscle over here that moves the jaw tightens up. It hurts right here. Patients come in every morning. It hurts right there, doc. You paralyze that muscle, it won't hurt for about 3 months. And then you got to get injected again. But what about this side? Or what about when the pain goes down here? And you end up chasing these pains all over the place using thousands and thousands of dollars of Botox, botulinum toxin A, that at best treats a symptom for a very short period of time, but not all the symptoms, because most patients have more than one symptom and in more than one place. Remember that litany of symptoms I went through, and patients with headaches will also have neck aches very commonly, or they'll have upper back and shoulder pain very commonly. And it reminds me of a story I'll tell very briefly, and then hopefully we can wrap this up. I had a young lady, relatively young woman, come in. She couldn't have been older than 25. This was 10 years ago, and it was stunning. She came in with multiple symptoms of TMD, shoulder pain, neck pain, fullness in her ear, but she worked for a plastic surgeon, and she had access to as much Botox as she could stand, and obviously didn't pay full price, or I don't know what she paid for it, but she had so much Botox in her face, she could not smile. There were no wrinkles. She could not smile. She could hardly move her lips, and her face was shiny. Her entire face was just shiny in the light. That's how much Botox you can get, and she was still having symptoms, and that's my point. So the doctors need to distinguish between what the cause is, the cause being chronic inflammation in the joint, just like chronic inflammation in the elbow, lateral epicondyle of tennis elbow, where the chronic inflammation is, causes pain in the forearm, from the muscles that pull on the bone when you do too much of repetition motion of the arm, the forearm. Too much tennis will cause inflammation of the lateral epicondyle. Lateral epicondyle will send an autonomic signal to the brain stem in the brain. Brain says, I'm telling the brain, I'm inflamed, I'm inflamed. Brain says, I'm going to help you out. Sends a signal back down to the muscles of the forearm that says, don't move that elbow, don't move it, tighten up. And patients will complain of forearm pain all along the forearm into the wrist, where the muscles get the signal to tighten up, and they pull on the periosteum of the bone, the covering of the bone. Where they pull on the periosteum, they stimulate the pain receptors, the nociceptors, and now they have pain in the forearm because the lateral epicondyle is inflamed. That same thing happens with the temporomandibular joint. There is no difference. TMD and tennis elbow are the exact same pathophysiologic disease. The cause is a little different. The cause of the damage is different. Damage to the elbow is too much repetition of the forearm. Damage to the temporomandibular joint can be bruxism, acute trauma, and functional malocclusion. But they create the exact same effect on the muscles, exact same effect. So, doctors, please don't conflate symptoms and cause. If you treat the symptoms, you'll be treating the symptoms forever because you're ignoring the cause. On the other hand, if you use a simple device that unloads the temporomandibular joint according to a proper protocol, because it is not just the device, it is, you have to know how to use it. You have to know how to use this thing that unloads the joint. That's all it does, but you can't do it any old way. You have to understand what you're doing, why you're doing it. You have to understand a little bit about chronic inflammation and how that operates, and how it's not an on and off switch. It goes up over time, it goes down over time, and you can predict how long it's going to take to get the effect. But the point is, that's why we have a protocol. That's why we have a company teaching doctors how to use this correctly. All right, with that being said, please try not to conflate symptoms with cause. If you will do that and use a proper device, which is licensed, patented, FDA cleared, and protocol, which has been worked out successfully for years to have stunning results, you can actually solve this problem for everyone with the disease. Everyone. With that being said, I invite others to contact me if you'd like. I'm available, Tony at tmjservices.net. If you are a dentist, doctor, who would like to provide this service for your patients, more information can be acquired at urbanektmj.com. So until next time, I've said what I needed to. I hope it is meaningful. I hope it's helpful to you if you're a patient, or to you if you're a doctor. This is a problem that can be solved. It doesn't have to be the Wild West of dentistry anymore. It doesn't have to be the Wild West of dentistry. And it's my job to solve that problem. Until next time, I am Tony Urbanek, and this is TMD Demystified.